So in a continuation of Unit 3, we're going to look at the spine now, the spinal cord as well as the vertebral bodies and the differences in them between the cervical, thoracic, lumbar, and sacrum and coccyx. So you can see here the cord. This is from Netter's, and the cord extends from the foramen magnum all the way down to about the level of L2. That's the cord itself. And you can see the cervical cord in green and the thoracic in blue, the lumbar in purple, and then the conus is in red. And there are normal enlargements in the cord in the cervical and lumbar region. Those are normal, and sometimes you really have to take a look at the cord to see, is that just a normal enlargement, or is it even abnormal, or is it too thin? So those are things that you have to take a look at when you look at the cord. More so the radiologist has to look at, but you might start to notice those things as well. As far as the nerves, there are actually 8 cervical nerves, as you'll see here, and then there's 12 thoracic nerves, 5 lumbar, 5 sacral, and then 1 coccygeal nerve. And as you'll recall, the dura mater and the arachnoid mater go all the way down to S2. So you can see that black line there is the termination of the dural sac, and the arachnoid follows the dura. And then the pia mater, remember, follows along the cord itself, so it would just come down to about L2 as well. And then that extension of the pia mater is a filum terminale, and it goes down and anchors the cord to the bottom of the dural sac. The cauda equina is just inferior to the conus, and that is the free-floating spinal nerves that come down. A few of the lumbar spinal nerves, as well as the sacrum and coccygeal nerve that come down. This is a midline sagittal T2 weighted MRI scan of the cervical spine, and you can see that the cervical cord, or the cord itself, extends from the foramen magnum and would extend all the way down to L2. There is normal cord here. You can see that the cord does not have an enlarged central canal, so you're not able to see the CSF space within it, which is the central canal. That's fairly normal. You have bright CSF here on either side of the cord, but as you look up higher, you can see the obex, which is where the 4th ventricle enters into the cord, and that becomes a central canal, and there is some increased fluid here within the cervical spine cord, and that is a syrinx, and it is because the cord is being pushed down from above or maybe pulled down from below. There's some abnormality that's causing some increase in fluid within that central canal. And you can see here the cerebellar tonsors do extend down into past the foramen magnum into the cervical spine area, and that is an abnormality as well. So we don't know whether it's being pulled down from below or being pushed down from above, but that's an abnormality. And the other thing I wanted to note here is that when you are counting in MRI scans, when you're counting the spinal bodies, it's really important to start from the top. You don't always have that possibility, especially when you're doing a lumbar spine. You don't always get to scan the entire spine. But people can have 6 lumbar vertebrae, it's possible, or they can have fused vertebrae that may make them look like one. So if you start from the top, this C2 body, the cervical body of C2, is very distinguishable. It almost looks triangular in shape. And then you would have the atlas here, and that is the cervical C1 body, and you can see just the anterior portion of it here and the posterior portion of it here, and it wraps around the axis of C2, and that's what makes that shape, and it allows the head to pivot on top of the spine. And so this is C2 here, and then this would be C3, C4, C5, C6, C7, T1, T2, T3, T4. And so that makes a more accurate counting when you start from the top, whereas when you start from the bottom, you could miscount, and it just depends on the person's anatomy. One other thing of interest here is that these cervical disc spaces have lost some of their space in between. You just can see there's a little bit compression here, and that the cervical disc is pouching out into the cervical cord and into the CSF area here, and those are all slightly abnormal. So when talking about the similarities between the different levels of the spine, almost every vertebra or vertebral body has the body portion of it. Some are much smaller, some are much larger, and we'll take a look at the differences along through this lecture. Also transverse processes and spinous processes. They're all a little bit different shape, a little bit different size, and we will cover those differences. And then in terms of the cord itself, you have an outer white matter. So this outer area here that's a little bit brighter white, that's the white matter. And then you have an internal sort of H shape, or kind of like a butterfly shape inside. That is the gray matter. So the darker area here that's almost shaped like an H is the gray matter, and then the external white matter. And you have the anterior, the lateral, and the posterior horns of the gray matter. And then you have the anterior or ventral root and the posterior or dorsal root. So ventral root and dorsal root. And the dorsal root has a spinal ganglion, and that is specific to the dorsal root. So when you are looking at the two roots and you're wondering which one is which, if you see this bulge here, that is the spinal ganglion, which makes it the dorsal nerve root. So the spinal ganglion is on the dorsal nerve root, and these nerves go in and out of the intervertebral foramen. So this is the intervertebral foramen here in between the body and the transverse process, and the nerve impulses go out to the body and then back in again. And this dorsal ganglion is like a transfer station of information. So the gray matter contains the nerve impulses, and the white matter is like the highway that they travel through to get in and out of the body. Looking at that on a T2 weighted MRI, we've got the vertebral body here. So this is the anterior side of the patient. Here's the aorta. You can see the cruise of the diaphragm here. And this is the posterior side, so this is the spinous process and the transverse process here. This is the intervertebral foramen. And you can see the spinal nerve. This is the ventral root as it comes off, and this is the dorsal root as it comes off, and you can see that little bit of a bulge. So there is a spinal ganglion, and so that's how you know that that's a dorsal root. So the H is not very visible here in this resolution of an image, but when you follow that H, you'll see the ventral root coming off the anterior side there of that H, and then the dorsal root coming off the posterior side of that H. And the H is the gray matter, and that is where the nuclei sit that produce the impulses. Just as a reminder, remember the dura mater is around the very outside of the spinal canal and contains the arachnoid mater as well. So that's just internal to the dura mater. And then between the arachnoid mater and the pia mater, which is just right up close to the spinal cord itself, is a subarachnoid space, and that's where the CSF fluid sits. So you got the dura mater on the very outside, the arachnoid, which is very, very close to the dura mater, and then the pia mater, which is right next to the cord itself, and then the subarachnoid space is in between. So as you begin to look at these images here from Netters, be sure that you remember that these are all flipped upside down. So these are the dorsal or posterior horns here. Remember, those are the longer horns of the H of the gray matter, and these are the anterior or ventral horns. And then the lateral horns are here, just these little buds here on each side. And there's a little dot in the central part of each one of these, and that is the central canal. Just a very small space in between there, and that's why we don't often get to see it on an MRI scan unless there's something abnormal about it. But you can see how each cord, each level of the cords, this is cervical, a couple in the thoracic, lumbar, and sacrum, are slightly different shape, and that you've got a normal enlargement in the cervical and in the lumbar spine as well. So those are normal enlargements in that area of the cord. But as you're looking at these in Netters, be sure you remember that the longer part of the H is in the posterior side or the dorsal side. and that these images are upside down as we are used to looking at them anatomically in MRI scans. And in this image here on the right, this MRI scan is a little bit lower resolution than what you might find today, and it just depends on what you're looking for when they do these scans. But this is again a T2 weighted scan. That's why you've got the bright CSF. And you can just make out that little bit brighter H that's inside, and you can see a posterior horn here, posterior dorsal horn of the gray matter within the little bit darker white matter that surrounds it, and then the bright subarachnoid space is filled with CSF. And we've mentioned it before, but the conus medullaris is the termination of the cord here in red. And then inferior to that is the cauda equina, which kind of looks like a horse's tail. And those nerve roots extend inferior from the conus, and they kind of free float within that subarachnoid space. And then the nerve roots exit out into the vertebral foramen, through the intervertebral foramen, and then out to the body. And we can look at that here on a lumbar spine T2 weighted image. You can see S2 and S1, so this is the sacrum here, and then L5, 4, 3, 2, 1. And you can see how if the lumbar spine was fused, like L5, S1 fused, you might get that confused and think that this is the sacrum all the way through. Or if the person had a 6th lumbar spine, which is possible, that your counting would be off. And that's why we always include at least T12 and sometimes a little bit of T11, maybe a little bit higher up if you can, depending on the height of the person, so that you're sure to include all the levels of the lumbar spine in case the person does have an extra vertebra. So we're going to take a look in the next slide at these nerve roots as they exit through the intervertebral foramen, so that you can see what that looks like on a sagittal T2 weighted spine. When you slice the anatomy or go to a more lateral slice than midline, you can start to see a little bit more of the CSF space, and then these wispy nerves coming through the CSF space, and that is part of the cauda equina. You can see those individual nerve roots as they start to head toward the intervertebral foramen. And when you look here, this space, these little kind of oval spaces between the vertebra are the intervertebral foramen, and you can see the individual nerves, the darker areas here, that are the individual nerves going out through the intervertebral foramen as they course towards the body and then back from the body again toward the cervical spine cord. Not cervical spine, but the spinal cord.